Hi everyone, my name is Lauren Vroom and I'm a labor and delivery nurse, and today I'm going to show you a bunch of positions that laboring women can assume while they're in labor. So the first ones are upright positions. Upright positions are very good for when you're in labor because they increase the pelvic diameter and allow for the baby's head to kind of move down with gravity and to rotate to an anterior position, which I will show you later with the doll. So one of the positions that they can take is, if they're in their room, they can use the bed. If you lift the bed all the way up to this level, the patient can stand with her arms like this. I'll come around to this side so you can actually see. So she can put her arms like this and her feet set apart, and she can rotate from side to side during her contractions with her head down or up, it doesn't matter. But this tends to be a very comfortable and convenient position during labor because it also exposes the lower back to the possibility of massage, which I will also show you in another clip. So this is one of the positions that's upright, great for the baby to come down, and also for the baby to rotate to the proper position because the back will come towards the front. So there's also just walking. The patient can walk in labor. We encourage that a lot. It's great to stimulate contractions. They can also do squatting if that's something they like to do. Maybe you've seen clips on the internet where women are doing dances and they're squatting. So if they have a partner with them, that's also great because in the squat position, the pelvic diameters are increased and the baby's head can really come and settle in low. So that's the squat. There's also a bunch of positions that we can use with the birth ball, and I'm going to show you now with your Mary Lou, who is our pregnant patient, and she's going to learn the positions with the birth ball. Alright, so Mary Lou, come on over here. So here we have the birth ball. This is super handy during labor. It's an alternative to being standing. Standing can become tiring, maybe patients don't want to walk anymore, and instead of sitting on a firm bed, they get to sit on a nice soft ball. So the way that we're going to sit on the ball is I'm going to grab a PK, especially if you were ruptured and so you would have amniotic fluid leaking. You wouldn't want to get it all over the plastic ball, and it also rolls on the ground and it's not super clean. So you take a nice clean PK, you put it over the ball. If you have nursing tape with you, a great tip is to tape all the way around the PK like this on the ball around the edges, and that way all four corners stay taped to the ball and it doesn't come off. So I'm going to hold it, but what I need you to do is to come in front, open your legs, and then sit back on the ball. Okay? So open your legs wide. Yeah, and sit on the ball. Okay, so there's some important teaching points with using the birth ball. Right now her legs are pretty much 90 degrees, and that's really important. She can't be on the birth ball like this because she could roll where you don't want her to go. If she has a painful contractions or leans to get something and her feet are out there, she could just roll right over. So you want to make sure that her feet are well supported, and also she can open them more. Yeah, exactly. So if you're having a contraction and you want to lean forward, so the same way that I did over here, you can put the bed all the way down. This is a great position to use in the room. So you'd have this same position. So you want to make sure 90 degrees, heels under knees, and legs far apart, especially if the bed's in front of her. So can you stand up? I'm going to have you resit right here. Okay. On the bed? Yeah. So I place the ball, oh no, turn. I place the ball close to the bed. Open your legs. Open, open, open. Okay, now sit back on the ball. Yeah, and you can have your legs in front of you like that if you want, or you can open them, and you also have the possibility to lean. Okay. Exactly. So this is a great position also because it exposes her lower back for massage. And when you're in a painful contraction, especially if there's a lot of back pressure, this is a good position for the husband, the nurse, the doula to come and do a massage while she is contracting in this position. It's also really great for the baby's head to come down, the pelvic diameter is increased, and it's just really helpful for patients. Sometimes they don't like it because being so vertical and sitting on the ball makes their contractions stronger and the pressure greater, so sometimes they don't like that. But it's very helpful for the labor. So another position, thank you Mary Lou, you can stand up, don't fall. Another position we're gonna assume is one that you can do in the room. So just hold the ball for me, yep. So you would grab extra PKs, Or you can grab towels or whatever's padding. Sometimes a pillow. A pillow is really nice too, actually, for the knees. All right, so I'm gonna place you, I'm gonna put this here. And I'm gonna ask you to come and put your knees right on this.
Okay.
Yeah, good. And you're gonna lean forward on the ball with your belly in front of it, kind of, and your chest around here. Yep. All the way forward on it. Just rest right on it. Yeah, so the ball basically is gonna go kind of up here so that you can roll on it during your contraction. Yeah. And if you wanted, you could open your legs more, you can roll the ball closer to you or further, but basically the idea during the contraction, so this is all fours position but modified with the ball, and the idea is that you'd be able to go to a squat. So I showed you before a vertical squat like this, but the balance is harder like that, so a great alternative is if she can kind of squat back like that during the contraction and roll forward. So during contractions, there's a rhythm. So contractions start off small, they get bigger and stronger, and there's a peak and it's so painful, and then it slowly comes down. So it's really like a wave. Strong peak and down. So the way that women tend to move in labor is very rhythmic. So they might want to roll forward and they roll slowly backward. And if you're accompanying them in labor, you don't want to do any sudden stuff like move here, do this, or massage like this, because it doesn't go with the flow. So this position is just really nice if they want to move. It's also really good to turn the baby in the right position because the back will swing forward and the head will be positioned in the right way. And I will also show you that with the doll. Thank you.